So I get a lot of questions about patients who are going abroad to have surgery done, or we have also had patients who have had consultation with us and decide to go abroad. Obviously, there are surgeons everywhere, and all surgeons can be bad and all surgeons can be good. You have to find out which surgeons are the better ones. But the issue with that whole thing is that you're going abroad, having a procedure done. Mostly they're having multiple procedures in one go, and then they come back without any aftercare. So patients don't know what is happening. If they have a wound that is not healing, or they are a bit of swollen somewhere, or they get a temperature in the evening, there is obviously nobody to go to, and then they get panicked and then go to NHS, for example. But as we know, NHS is overflown with already a lot of patients. So sitting in A&E for hours and hours and then being sent away because you can't be seen by a proper plastic surgeon, then going home and then sitting there and having the complication, it's not always good. So what we do, we give aftercare. All the patients have always access to emergency numbers. They can always come back. We see the patients regularly, mostly within the 2 weeks, a few times, and then 3 months, 6 months, 9 months, and 12 months even, depending on what procedure they have had. The bigger the procedure, the more aftercare we give, the more we sit behind the social approach and the whole alternative way of helping patients to get recovering soon. We have had quite a few patients lately, but I have discussed this before. The patients are coming with a lot of huge and big complications because they have had that procedure there, and then obviously we can't do much about it until it's healed, and then we go back. And the initial thought of the patient has been to go somewhere cheaper, but at the end, most of the time, it ends a lot more expensive.